If you've seen one health department in Missouri, you've seen one health department. Missouri's public health agencies are tasked with protecting population health and preventing the spread of disease, fundamental services that are not provided by any other governmental entity. And yet the public health services provided by Missouri's health departments differ widely. Diseases, hazards, and germs are not limited by county borders, but public health funding is. Increasing demand for services with shrinking resources have contributed to fragmentation in public health service delivery across Missouri. Simply where you live can determine whether or not you receive critical population health programs or services. And available state funding does not necessarily address the highest priority needs or benefit everyone equitably. So if you have seen one health department in Missouri, the next one is sure to be different. This fragmentation of governmental public health is not unique to Missouri. It is occurring across the nation. Like Missouri, many states are embarking on public health system transformation efforts, beginning with the development of a foundational public health services model. A foundational public health services, or FPHS model, defines a minimum set of fundamental capabilities and services that must be available in every community in order to have a functional health system. These critical gears make up the core of Missouri's complex public health system, assuring every Missourian has a fair opportunity for help. Additional gears can be added to improve system outcomes. Some agencies offer services specific to their community or seek voluntary accreditation through FAB or MICH. The overall goal, however, is effective and efficient population health management with health equity and social determinants of health as a focus throughout. Public health professionals in the state of Washington were the first to attempt a transformation of their state public health system. The creators of the Washington FPHS model then collaborated with public health professionals from across the U.S. Building on the core public health functions and 10 essential services, they created the first national foundational public health services model. So the national FPHS model was created by public health professionals, for public health professionals, as their framework for transforming a fragmented public health system. The national model has since been revised and used by several other states. Each state made changes to the appearance of the model, changing specific wording or calling out priorities such as health equity, but so far, no states have removed any services from the original national model or changed its fundamental structure. Missouri's model follows suit. While the visual look of Missouri's model is unique, the language mirrors that of the national model. Through its grassroots HealthierMO initiative, Missouri formed a foundational public health services workgroup in May 2019. These 24 representatives of state and local public health agencies and academic institutions identified key components in the Missouri model and helped define its visual presentation. Local public health agency administrators provided additional input during focus groups held in September 2019. Finally, draft models were developed and presented to the initiative's executive committee for review. Final changes were made based on the recommendation, and the final version of the Missouri model was approved by the executive committee in December 2019. Missouri stakeholders recommended only 3 changes from the national model: separating out injury prevention as its own area of expertise, including behavioral health and community resources under linkage to care, and specifically calling out health equity and social determinants of health in the model. Missouri also added an outer ring to its model that recognizes local responsive programs and services as a vital component to assuring population health. Missouri's FPHS model offers a simplified operational framework that identifies the unique responsibilities of governmental public health in Missouri. It provides a consistent description of the fundamental public health capabilities and services that must be available in every community. The framework allows LPHAs to determine the cost for delivering foundational public health services, identify capacity gaps, and justify funding requests, all in an effort to help close the gap between what local public health agencies need to provide and what they are able to provide. The Missouri model defines 7 cross-cutting skills required to assure the delivery of foundational public health services and achieve equitable health outcomes. These foundational capabilities include assessment and surveillance, emergency preparedness and response, policy development and support, communications, community partnership development, organizational administrative competencies, and accountability and performance management. The model also identifies 6 interconnected areas of public health expertise best provided by governmental public health agencies. These foundational areas include chronic disease prevention, communicable disease control, environmental public health, maternal, child and family health, injury prevention and linkage to medical, behavioral, and community resources. The foundational capabilities and areas are all interrelated, so that each of the capabilities can align and be integrated with each of the foundational areas. Rather than focusing on individual programs defined by limited funding streams, Missouri's FPHS model describes a minimum set of measurable capabilities under each area that are truly essential in every Missouri community. These capabilities will be further defined in a capacity assessment and then attached to a measurable cost for delivery. Each LPHA may determine the best strategy to achieve the capabilities in their own jurisdiction. Resource sharing, collaborative partnerships, and innovative solutions are just some of the effective methods that are already being used by Missouri LPHAs to assure foundational public health capabilities. Missouri's FPHS model highlights health equity and social determinants of health as a focus through which all public health programs and services should be provided. The model allows LPHAs to add their own local responsive programs and services that may not be foundational statewide but are vital to meet identified needs in specific communities. LPHAs depend on a network of partners to assure that community members have equitable access to the expertise and resources necessary to address many of the underlying causes of poor health, like transportation, housing, access to healthy food, and opportunities for exercise, health literacy, and health insurance. Missouri's public health agencies have a rich history of creatively solving the challenges of increasing demand for services with shrinking resources. Missouri's FPHS model offers public health agencies a framework upon which to lead their communities through strategic planning and implementation of innovative solutions that assure a stronger public health system and offer every Missourian the fair opportunity for health.